Thank you very much. Good afternoon, Professor Gauman and Professor An, and dear audience. I'm Pei Qi Wu from Taiwan, National Taiwan University Hospital. My topic today is prevalence and risk factor of nocturnal polyuria in women with LUTs based on bladder diary. Nocturnal polyuria may decrease the treatment efficacy of LUTD, and adjuvant medications such as desmopressin may be needed. And the knowledge of the prevalence and the risk factor of nocturnal polyuria might be important for the treatment of women with LUTs. Thus, our aim is to describe the prevalence and risk factor of nocturnal polyuria in women with LUTs. Between September 2010 and January 2019, all women with LUTs visiting a urogynecologic department of a medical center were all included. All of them complete a 3-day bladder diary. Nocturnal polyuria was defined by that the proportion of nighttime voided burden divided by 24-hour voided burden, and was greater than 33% in women equal to or older than 65 years old, or greater than 20% for women younger than 65 years old. A total of 3,000 women with LUTs were included in this study. The rate of nocturnal polyuria was 27%, with 18% in the elderly group and 32.6% in younger women group. And the highest rate of NP was found in women older than 81 years old in the elderly group, and in women in perimenopausal period in the other group. The women with LUTs were divided into 9 groups according to their 3-day bladder diary. The diagnosis of OAB was based on the presence of at least one episode of urgency. OAB weight was diagnosed in women when at least one episode of urgency incontinence was recorded. Otherwise, OAB dry was diagnosed. SUI was defined as any involuntary urine leak on physical effort or exercise, coughing, sneezing, and lifting. If the bladder diary revealed that the individual has to wake up at night 2 or more times per day to void, nocturia was diagnosed. If the woman has to void 8 or more times a daytime per day, she's assigned to frequency group, otherwise normal group, and we should focus on the nocturia group. The age-specific prevalence of NP and prevalence NP in each group were shown as figure. The highest rate were around perimenopausal period and in nocturia group, respectively. For younger women, the prevalence of NP in each group were all higher than the elderly group, the elderly woman. No matter the younger woman, elder woman, or all participants, the highest rate of NP was in nocturia group. The age-specific prevalence of NP in each group also revealed that the highest rate was in nocturia group. In univariate logistic regression analysis, age, daytime frequency episode, nocturia episode, urgency episode, and total fluid intake were all statistically significant. In addition, many symptoms and all domains of King's Health Questionnaire were statistically significant. Backward stepwise multivariate logistic regression analysis was performed and revealed that daytime frequency episode and nocturia episode were independent predictors for nocturnal polyuria. ROC curve analysis revealed that daytime frequency episode less or equal to 24 was an optimal cutoff value to predict NP with AUC 0.54. Nocturnal episode with more or equal to 5 in the 3-day bladder diary was also an optimal cutoff value to predict NP with AUC 0.82, and we can use propensity score matching method to derive logic of P. The predicted logic of P for a given daytime A and nocturia episode B can be denoted by this equation. And the optimal cutoff value of this equation is more or equal to minus 1.49 to predict NP using ROC analysis with AUC 0.85. Although daytime frequency episode is a poor predictor due to low AUC, nocturia episode and logic of P are both good predictors due to high area under the ROC curve. So this is our concluding message. Nocturnal polyuria is common in women with lots, especially in women with more or equal to 5 nocturia episodes in their 3-day beta diary. Nocturia episode and daytime frequency episode are predictors of MP. And also, in addition, we can use logic of P derived from nocturia episode and daytime frequency to predict MP. Thanks for your attention.
So one question that I have, and one of the strongest predictors was fluid intake. That was highly significantly correlated with NP. So the question is, was there any normalization using diaries to see, if patients were taking a lot of fluid in the evening, that obviously is going to have you produce more fluid in the evening. Was there any normalization done to sort of flatten all that out?
Thank you, Professor Gorman, for your question. This is a very important question because we know that the possible physiology of nocturnal polyuria might be the dysfunction of circadian rhythm. And if one have normal circadian rhythm, even she drank a lot of water in the evening, maybe the maturation will be for her sleep and not during her sleep, because our pituitary may do something to stop the maturation at night. But there's one interesting I found in our study is that, the lowest rate of MP was not in the elderly group. On the contrary, the lowest rate of MP was found in between 71 and 80 years old. Are they old? Yes, they are old enough. But why they have the lowest NP prevalence? That's I'm still thinking about it. So I cannot answer you the question if they drink more water in the evening and they will have more maturation at night. I think if they have normal circadian reason, they might not have this condition.
Okay. Thank you very much.
Thank you very much.
All right. The